Dr. Roiyah Saltus, and I would like to welcome you to the second plenary of the conference. Now, this last year has caused us all to sharpen our focus on inequality in all its many facets. The COVID-19 pandemic has revealed long-established inequalities and their deathly impact. Likewise, the global movement, the Black Lives Matter, has revealed to us and impacted on the research community. Attention has been drawn to the ways in which structural barriers negatively impact minority communities in all stages of the research process, from inception of idea, the design of the study, through to dissemination. This session will be an opportunity to hear about why embracing inclusion, diversity, and equality are vital for effective health and care research. Now, this is not a new focus for Health and Care Research Wales, and in its previous incarnations, program funding has supported studies that have sought to embed an equality framing within Wales's health and social care research infrastructure. Having myself conducted research in the field of health and social inequalities, with a particular focus on marginalized migrant and minority ethnic populations, I especially welcome this session. I hope that in Wales, this focus on inequality and underpinning social inequity as linked to research is not a passing phase or a moment, but a real groundswell and a movement for the better. Now, today we have the opportunity to hear about the developments taking place at the National Institute for Health Research. We will learn more about the research taking place in Wales, and we will be provided with a real case study of how to work to ensure an inclusion, diversity, and equality strand is interwoven through a study. Let me tell you about the speakers briefly and the format we'll be using for this session. Our first speaker is Dr. Esther Makuka. She is based, as you know, at the National Institute of Health Research, and she leads on the ongoing development and implementation of their equality and diversity and inclusion strategy, embedding the key action points underpinning the strategy across all the organization's activities and the wide range of people that the NIHR brings together. Now, that's a huge undertaking. It is a huge undertaking. And she seems best suited, for she is an established EDI practitioner with experience leading equality inclusion in higher education, the health sector, and the private sector. Esther, we look forward to learning more about the work taking place with our big sister organization across the water. Please leave us with some challenges to take up here in Wales and space to explore perhaps future collaborations. Our second presentation is from Dr. Ashra Khanna, Senior Research Fellow, Swansea University, and Hamid Granberry, who's a peer researcher and also works at Swansea University. Ashra's research interests and expertise lie in the fields of emergency pre-hospital unscheduled care, primary care, and interventions to reduce unequal access to healthcare, especially among vulnerable population groups. For her, those population groups include high-intensity callers to the ambulance service, asylum seekers and refugees, and looked after children. Ashra describes her research as a pragmatic research. Her aim is to find ways to address socioeconomic determinants of health from an intersectional approach. That is an approach that presupposes data collection on factors such as social markers of gender, ethnicity, sexual behavior, or age. Moreover, taking on the fact that knowledge comes in many forms and is generated in many different spaces, Ashra's research seeks to make real change and impact in the world of policy and practice through cooperation, co-production, and co-design with services and people. Importantly, the format of the presentation, or the second presentation between Ashra and Hamid, will be an in-conversation. It will be a dialogue between the two of them. Mohammed, as I said, joined one of the studies Ashra will be talking about, the HERE study, as a peer researcher in 2018. And he's here today to share his experiences as being a peer researcher. And we'll no doubt hear more about his life story as we go along. Now that is my 5-minute introduction. May I leave or at least offer 2 reminders before we start. For the delegates, number 1, for the delegates who use Twitter, if you tweet, please use hashtag ResearchWales21. Also, we want to have a really good question and answer. So if you have any questions, please post them throughout the presentations by clicking Ask next to Have a Question at the right of your screens. Now, perhaps more importantly for me, can you please vote, or if you take the opportunity to vote on the questions, because that will help me figure out what the majority of you would like to address, what questions you would like to have addressed. Now, from this point, we will move seamlessly, I like to think, we'll move seamlessly from the first presenter to the second in-conversation presentation. Esther, as you know, you have 15 minutes. That will take us hopefully to 2:05. Then the second presentation will start, and that is set to end at 2:25. Timekeeping will be important, and we will prod accordingly. But I know that probably won't be necessary. But importantly for us, that would leave us time for questions from the attendees. So without further ado, I will welcome the first speaker. Thank you and enjoy.
Thank you, Roya, for that introduction, and thank you to everybody who's joined the session. My name is Esther Makuka, Head of Equality, Diversity and Inclusion at the National Institute for Health Research, and today I'll be talking to you about what the NIHR is doing to embed equality, diversity and inclusion in its systems, processes and culture. So what I'll cover this session, I'll cover our approach to diversity and inclusion and equality. I will cover our strategic commitment, which we've stated in Best Research for Best Health, the next chapter. I'll also give examples of what initiatives we've already implemented, and then also cover our future initiatives that we are planning in our strategic process, and then finally close on our approach to diversity and inclusion. I want to kick off by saying that the NIHR, like other funders, is still curating its approach to EDI, and a lot of our interventions are in their embryonic stage at the moment, but we have taken some action, and I can share those with you as we go along the presentation. So the NIHR has made a strategic commitment to EDI, which we have clearly articulated in Best Research for Best Health, the next chapter. And if you haven't read that, I do encourage you to read that, because we have clearly stated where our strategic focus will be on for the next 5 to 10 years. And our ambition is that we develop researchers from multiple disciplines, specialisms, geographies and backgrounds, and to work to address barriers to career progressions arising from characteristics such as sex, race or disability. It is important for me to state here that we have broadened our focus to inclusion, and that means that we are able to look at protected characteristics, but we're also able to look at career and progression. We're able to look at demographics within research participation, and that broad approach means that we can take a spotlight approach to our intervention, but also a searchlight approach, which ensures that we're embedding EDI in everything we do. So just to reiterate that the NIHR and the Department of Health and Social Care has really committed itself to equality, diversity and inclusion, and our strategic focus is to embed EDI in our research systems and culture. But what does that look like in practice for us? And as Roya clearly stated, it is a massive job if you know the scale and the size of the NIHR. So what we've started to do is really break down where we need targeted interventions under that umbrella of creating an inclusive and diverse, equitable culture across the NIHR. One of the areas we've started with is our policies and principles. And some of you may be aware that the NIHR recently published its policy for the prevention of harm, which covers bullying, harassment, and victimization in the research community. The NIHR knows that we still have more to do, and we want to work with other funders to develop principles that enable us change research culture and address some of the issues, the biggest challenges in research culture. Communication and engagement is so important. You would know that to engage with the different communities that NIHR is trying to reach, we've got to ensure that our communications is inclusive and targets those diverse communities in a way that is effective, but in a way that is also respectful. And so we are doing a lot of work. You may have seen our Be Part of Research campaign. We are building on activities like Be Part of Research campaign to really broaden and reach those communities that we want to engage with, and ultimately we want to take part in research. Our processes need to be looked into. So what we're doing is what we've started recently is looking at the funding life cycle and what takes place, what researchers experience when they put an application to the NIHR. We want to ensure that we are making inclusive decisions about funding, but we're also being inclusive in the type of research that we fund. And so we've kickstarted a project called Greater Diversity and Greater Inclusion on committees and panels to really delve into that. We're going to be publishing demographic data for the first time next month, and everyone will be able to see our baseline data for the demographic of the NIHR. There is still more work to do, but the data we will be publishing gives us a baseline and gives us an idea of where interventions are needed within the NIHR. Learning and evidence is important, and again links to some of that data work that we're doing. But ultimately, we want to be measuring diversity and inclusion to build a robust evidence base for the work that we need to do in the next 5 to 10 years. And I'm currently writing a EDI strategy for the NIHR, which will be out for consultation. Well, some of it will be out for consultation, where we will tease the key themes and key activities that we want to implement within the NIHR. That will also happen next month. So I've already spoken about some of the activities we've got on the way, but I thought I should touch on some other things that we've been doing. So one of the targeted actions we've taken this year is that we've added specific inclusion requirements for programs such as the research professorships nominations. And building on gender, we've asked higher education institutions to ensure that there is one nomination from an ethnic minority background. Now, this is a big step and indicates some development from where we started, given that we are asking institutions to ensure that they're thinking about what pool they are providing the NIHR with in terms of research professorships. We've added positive action statements to our recruitment for committee members and panel members. And this is really important because we want to ensure that we have a diverse group of people making a decision about where funding goes. For us, this signifies a step in the right direction for future work that we've got to do. We're also widening the reach of our recruitment campaigns, and we've been partnering with Black British academics to tap into a pool of diverse researchers to sit on our committees and panels. We've done our data analysis, like I commented on earlier. We now have data for our research workforce and advisory workforce, and we're doing some work on data on study participants. Who takes part in our research? If you've seen, you have seen what's happened in the past year, 2 years, and the importance of ensuring that there is a wide demographic being able to take part in research, ultimately because you do better science when there's a diverse population to tap into and to be part of studies and clinical trials. So this leads me on, and I'll end nicely here onto the NIHR's future strategy. Our future strategy is clear. We want to deliver the ambition that we've already stated in Best Research for Best Health, the next chapter. We want to ultimately be an inclusive funder of research, and we are already making some strides towards that. But we want to ensure that people have the funding to actually do inclusive research. We want to ensure that people can incorporate inclusive research design in their application processes. And so we want to co-develop some of those principles there. I can't talk through all of the activities there, but I will highlight some of the important ones under the theme. Widening participation for greater diversity and greater inclusion is one of our themes. And this really speaks to how we can ensure that the right communities and the right people and the diverse communities, I should say, are taking part in research. We're working with our local clinical research networks to ensure that we are getting into those communities. And if you've heard about the Include framework, we're already using the Include framework to get researchers to think about what communities need to be represented within their research. The talent pipeline issue is one that we've got to address. And here I'm really focused on building the infrastructure that will lead to research in the next 5 to 10 years. And what we need to do here through our, the NIHR Academy is to focus on early career researchers, mid-career researchers, but also do work, outreach work to address some of the gaps in the system from school to high school, then to undergraduate degrees. So what can we do to ensure that we're not losing talent during the earlier stages in people's education? Evidence-led diversity and inclusion, like I say, we want to collect equality and diversity data, but we want to do more by building that robust evidence base for the NIHR's activities and interventions. And one of the things that I'm keen on that the NIHR does is that we measure inclusion, diversity, but we equally put a focus on measuring inclusion, because you can't have one without the other. And this is where you come in, really. We want to collaborate with our partners for impact and sustainability. We cannot do this work alone. I can't, as head of EDI for NIHR, do the work of embedding EDI in research and in clinical studies and trials. And so we need to collaborate with our partners. And the NIHR wants to create a platform for sharing best practice and for ensuring that we are talking to each other about what works if we want to do inclusion effectively within the NIHR, within health and social care, but also if we want to address those big challenges within the health and social care system. My challenge to you really is to encourage you to, as Roiyah said, not see diversity and inclusion as a phase, but as something that we've all got to harness our energies and expertise to deliver. I look forward to your questions, and I'll hand over to Roiyah. Thank you.
Hello, everyone. My name is Ashra Khanna. I'm a senior research fellow at Swansea University Medical School and also part of Prime Centre Wales Research Network, which is funded by Health and Care Research Wales to develop and coordinate research proposals and support researchers. I would also like to add that before I became a researcher, I worked as a community development officer for several years, focusing on social cohesion and engagement. So today I've been asked to join this great panel to talk to you about the importance of inclusion, diversity and equality in relation to health research, and to illustrate this with an example of a project that both I and Hamid have been involved in. So Hamid was a peer researcher on the NIHR study where we looked at the health experiences of asylum seekers and refugees in Wales. I will begin with an introduction of my understanding of the role of inclusion, diversity and equality in research. I will then talk about the NIHR study in terms of the research environment which we created to facilitate collaboration, and then we'll end with asking Hamid a few questions about his involvement in the NIHR study and any insights he would like to share with us. So inclusion, diversity and equality in research is about ensuring that a fair representation of voices are heard throughout the research process. It is not a new concept. Certain disciplines, in particular the social sciences, nursing, education, have been doing it far longer than others. There are a range of voices that could be included in research, but not all are equally heard. And this is determined by language, race and culture, education, class and place, and gender, sexuality and different abilities. I'm going to be slightly controversial here and say that I cannot really talk about inclusion and diversity and equality without acknowledging the elephant in the room. So EDI is very much a political issue where past and current power structures frame people's experiences across the life course. And so both researchers and people included or not included in our research are influenced by these power structures. So for example, when I've asked people to get involved in research, some say they don't understand what the term research means. Some say, what is the point? Nothing ever changes. Or others say they're not clever enough or have felt intimidated by the research language and environment. So COVID-19 has certainly exposed the fragility of our current systems and showed us what happens when we fail to address power structures and inequity in terms of race, class and geography and in wealth. Deaths and ongoing ill health problems related to COVID-19 have disproportionately affected people who are lower down the income scale and people from ethnic minority groups. But how do we address these big systems levels issues as researchers on the ground? Not all of us will become the Julian Tudor Harts or Michael Marmots of the future, targeting our research towards understanding why structures are perpetuating disadvantage. As researchers, we are required to be apolitical, and those who stray into the realms of addressing inequity are in danger of being labelled as social justice warriors, being woke, supporting cancel culture, or far worse, communist. And are there systems in place to support researchers who want to address inequity? So my personal view is that without understanding and addressing inequity, inclusion and diversity can become meaningless, tick box exercise. So I'll leave that open for future discussion. So bearing in mind the power structures inherent in our society, how do we go about closing the equity gap through our research? Well, firstly, researchers on the ground cannot do it alone. It needs to begin higher up the chain. We need to ensure that a fair representation of voices are heard at the research prioritization stage, which determines which topics are of interest and needs further investigation. So like, for example, last week, I was really pleased to hear that a new drug had been developed to ease the condition of sickle cell anemia, which can be a very painful and debilitating condition that starts in childhood, affecting many people from Black and Asian heritage. I heard a doctor saying that it has taken this long to develop a drug for sickle cell because it was not seen as a priority area. This takes me to the diversity of the decision makers who decide which research team and what type of research is funded. Historically, conditions that affect female patients have been underfunded, as is mental health, which is said to be the cause of approximately 23% of all ill health, but only receives 5.5% of research funding. The third point here is the research environment, which I will go on to talk more about in detail later. Finally, I'd like to mention the dissemination of research. Who is involved in this dissemination and who gets to hear about it? The COVID-19 pandemic has definitely highlighted the need for a greater focus on sharing knowledge that is accessible to all. In its absence, there are more opportunities for misinformation and fake news to flourish. So how do we do that? And this will also depend on the message design, the audience, and the medium used to disseminate that information. I'll just give a personal example of my own learning. So those of us who grew up in the 80s will remember Tomorrow's World on TV. Well, that was one of our family's favorite programs to watch. So Judith Han, Maggie Philbin, and the others sort of demystified new developments across the sciences and made this knowledge accessible to a 9-year-old me. But I didn't go on to become a mathematician or a physicist or a doctor or engineer, but it definitely gave me the confidence to want to understand research and stay interested in new scientific developments to this day. So now I'll talk about the research environment in relation to the HERE study. The HERE study was commissioned by Public Health Wales with the aim to explore the health experiences of refugees and asylum seekers in Wales. So inclusion, diversity and equity was at the heart of this project. So even before we wrote the bid, we were aware that our research team needed to be representative and diverse. So we thought about ways to include asylum seekers and refugees in our team. We hoped this would enable us to gain the trust of the wider sanctuary-seeking population, who often have a high level of distrust of institutions and authorities. So our diverse team included the NHS, Public Health Wales, third sector organisations who included Displaced People in Action, the Welsh Refugee Council, British Red Cross, and the Ethnic Youth Support Team. The team also included university students and peer researchers who themselves were sanctuary seekers. And between us, we spoke French, Arabic, Bengali, Farsi, Pashto, and Urdu. So we hope that our diverse team would also create a safe place for people to be heard and become involved in research. While we costed in our budget one third sector development officer to support engagement and involvement, a number of contributors, especially the third sector organisations who already operate on a tight budget, did not receive any financial reimbursements as we had a very small budget. So if research is truly to be inclusive, then we need to ensure that funders allow for these costs to be included in the funding streams. We faced an additional hurdle in that we could not pay our peer researchers for asylum seekers due to immigration rules, nor could we use vouchers, as the university policy did not allow for their use. So we looked at alternative ways to recognise their contribution. We provided everyone with a food hamper, a certificate of recognition, and a plaque which was presented by Dr Frank Atherton, Chief Medical Officer in Wales, at our stakeholder dissemination event. And the icing on the cake for the peer researchers was winning the 2019 Health and Care Research Wales Award for Public Engagement. And recent conversations with our public members on the follow-on HERE 2 study, looking at access to interpretation services in healthcare settings, highlights other forms of support and reward, supporting and rewarding engagement. The public members mentioned that the university could offer access to course modules for free to help people gain new skills and confidence to support their engagement and help with future career development. So how do we ensure an equitable, inclusive involvement in research? Well, first step as a researcher or institution is to explore and reflect on your own beliefs and values. You may have certain biases against diversity and inclusion. You may feel uncomfortable about the whole process. You may not see the need for it or question why change is needed, or believe there is equal opportunity already for all to have their voices heard. Secondly, if inclusion, diversity, equality matters to you, then it is important to know your community of interest and not wait for them to come to you. So whether you work in a lab or with patients, your work will ultimately have some impact on people. For example, if your interests are in reducing reoffending by ex-prisoners, then volunteering with charities will help you understand the population, the challenges, the barriers they face, and offer a route into sort of embedding inclusion, diversity, and equality into your research. Access to resources in the form of time and money is needed to build relationships. Taking someone out for lunch or for coffee to discuss the project informally helps to cement relationships. I'm sure our senior management team at our universities do this already when they try to attract private sector funding. And we could do the same to ensure inclusivity in our research, but at a lower cost. So engage early. It is important to talk to public members or groups before you begin writing the research. And I'm pleased to say that Health and Care Research Wales provide funding to support this early engagement by paying for the time your public members spend in helping you develop the study. The ability to be flexible, adaptable, and accessible is key to inclusivity. You have to be prepared to adjust your time to meet the demands of your group. This could mean working weekends and evenings. So, for example, when I was working on the Growing Up in Wales study that included parents, I even called potential research participants on Boxing Day because I knew I had more chance of recruiting fathers to the study, and it was successful. It did work. Clarity of roles is important. Be clear what role you want your public members, NHS or third sector organisations to play in your research. Be clear also about the research team and their roles. And I've already mentioned reimbursements earlier. The research environment itself can be an enigma to people not used to formal settings or not seeing people like them in these places. It's up to us to make people feel comfortable, hold meetings in the community, have walk and talk meetings, ensure your research team also reflects the community in terms of diversity, and ensure that the verbal or written language reflects used for information is clear and jargon free. People getting involved in research for the first time require mentoring and coaching, and it's important to allocate resources to support people. So, for example, within our team, Dr Roiyah Evans provides that conduit support to public members. I'm also part of the SAIL consumer panel as well. And what I realised from being involved in these groups is that it's important to have a mixture of experienced and new public members on these groups to enable sharing of knowledge and guidance. So there's a two-way knowledge sharing experience provided there. Finally, feedback is important. Thinking about how that can be done. Your community of interest, for example, I'll use the ex-prisoners example again, are unlikely to be reading journal articles or attending conferences. You can hold end of study dissemination events jointly with groups that support them to disseminate your results, or you could disseminate results to all those involved in your research. You could also produce infographics, share information on WhatsApp messages, feedback. Also, there's also the possibility of sending out links, YouTube links, video links to people, and it's very easy to make these YouTube videos yourself. So here are some of the benefits of enabling inclusion, diversity, and equity. Inclusion and equitable access to research offers us the chance to demystify research and make it more accessible and hopefully achieve wider impact. It's a good way to sort of identify needs and gaps in research, which can help reset research priorities and resources. It provides opportunity for two-way learning. It helps researchers and those involved develop new skills, knowledge, new networks, and empowerment of the people involved, which will hopefully help us to address some of the inequities in society and improve health outcomes for all. I'm pleased to say that some of our peer researchers and collaborators in the HERE study have successfully moved on to other roles. Our third sector co-applicant, Rebecca, is now working for Public Health Wales, and she's developing an online training module for healthcare professionals based on the findings from the HERE study. One peer researcher is working as a teaching assistant, another is working for Welsh Government and opening access to employment, and continues to contribute to research. So now we'll hear from Mohammed shortly, but before I do that, I'd just like to acknowledge the HERE team. And I would like to thank Public Health Wales for providing the funding for the project. The people including, and everyone including here, including the peer researchers. Also, some of the team members gave their time for free, including Professor Ian Russell and his wife Daphne, Melody Ruddoch, who now works for Natural Resources England, Catherine Manning from the British Red Cross, and students Talha and Wadad. So now I'd like to introduce Hamid. So Hamid, thank you for joining us today. So before we begin, could you tell us a bit more about yourself?
Hello everyone, I'm Mohammed. I've been living in the UK for 3 years, and Swansea was the first place I started my new life in the new country. I came to the UK through family reunion visa to live with my wife, who had moved here 2 years earlier, but I couldn't be with her due to some immigration laws at that time.
So Hamid, how and why did you get involved in the HERE study?
In Iran, my country, I was working in IT. Since the first day I moved to the UK, I was looking for a job related to my skills, but it was too difficult for me to attend interviews and complete job applications because of my lack of experience of working culture here and my English language as well. Fortunately, I could find a job in a factory after 3 months. It was an hour's drive to that working place, and it was on the motorway. It was really difficult for me to travel there every day without access to any public transport. Unfortunately, I lost that job after a month because of redundancy. During that time, I also decided to apply for volunteering jobs, and I found the Swansea Council voluntary service. I asked if I could volunteer as an interpreter for Persian or Farsi people, and did that for a while, worked there as an interpreter. After a while, they asked me if I'd like to be a peer researcher in the HERE project to help collect research data for the study.
Thank you. Was there anything that's worried you before you got involved?
Yes, actually, I was worried first about speaking to people from different backgrounds and cultures, speaking to them about the study and then asking them some questions related to their life. It was too difficult for me. I was worried about that. What if the people I contacted refused to talk to me, or what if I couldn't explain a question on the survey in an appropriate way to them?
Thank you. What changed for you after you got involved?
I learned a lot about the team and about teamwork and how people work together to keep a kind of research project going forward. This was completely new for me. It was also the first time I got involved in a teamwork in the UK, and that helped me to become familiar with this society and improved my confidence and helped me to become more involved with the community. It was great to know that it was easy to be a part of the team and to help others to have a better life for the future. I also had a chance to meet the brilliant research team and the very helpful team lead, Ashra. During my involvement, I found out about the data science building and Swansea University and how I could apply online to find a much better job than the previous factory job.
Thank you. And what advice would you like to give to people who may be thinking of getting involved in research?
I like to say to people who are interested of getting involved, please don't hesitate about getting involved. Just do it if you have the time. It's a great opportunity for young people and anyone who are new to this country or community. It makes you feel that you are a part of this society and you can improve your communication skills, communicate with all types of people from different backgrounds, which is a vital skill for everyone who wants to have a great future together.
Okay, the last question. What advice would you like to give researchers to help get people involved?
I think it is very challenging to do a research with people from different backgrounds, but it helps if the team are helpful. They help with transport and provide us with information on how to speak to people. Also, people who are asylum seekers and refugees come from different culture. If you are asking them to fill a survey, you need to consider this. Also, people need to be motivated or helped to complete a survey. Most are looking for information or more support instead of vouchers for completing the questionnaire.
Okay, thank you. Thank you very much, Hamid. Thank you. We've run out of time now. Thank you very much.
Yeah.
Okay, thank you very much. Thank you to all the speakers. First of all, there are a few questions, so I'm just going to jump right into the questions that some of the attendees have asked. The first question, and these for all have a go at answering the questions because they do speak to both presentations. First one is, what can we do to ensure that EDI can become properly integrated into all that we do and not just a moment? So perhaps maybe 2 or 3 key points raised from in your presentation or what you've thought of since.
You can go ahead, Ashra, that's fine.
Okay. I think what would be useful is, I think we need to sort of monitor that equality and diversity inclusion is included throughout our research process. And I recently learned that the Nuffield Trust have a checklist that before each project, they start working on a new project, they actually have a checklist to see where in that project equality and diversity is being addressed. So something like that, I think, embedded across our research systems would be a good idea. And also, I think maybe having some sort of network of researchers who sort of are experienced in this area might also be a possibility, so that other people can just sort of tap in to us as a resource, maybe to sort of advise on how to do it.
So unfortunately, because of time, I couldn't cover my last slide, but my last slide was going to speak to this actually. And for me, I think organizations need to see this as take a systems level approach to EDI to ensure that it doesn't just happen for a moment and we make big commitments and then that's it. And so the pathway that we are adopting is that of looking at our governance and ensuring that EDI is embedded in our governance. So how do we build the EDI ecosystem within the NIHR so that it's constantly on people's minds is one idea. How do we ensure that we're taking a data-driven approach as well, and rolling data collection and analysis into business as usual? When the demographic data stares at you, you can't deny that there is an issue. And I think we need to be thinking how we embed that in our system. I think leadership needs to take accountability for things, and again, it leads back to the governance, but there needs to be a commitment. And this is why the NIHR has stated in Best Research for Best Health that we are going to be doing this for the next 5 to 10 years. Awareness and education and critical interventions are required. So I would say I need a spotlight on EDI, but I also need a searchlight on EDI, that if I search through all of your processes, I've seen EDI being weaved through all of your processes. But I also need to have those spotlight interventions like a fund or a specific grant that people know or researchers know that they can tap into to ensure they've got the funding to do EDI effectively. So those are just a few thoughts for me.
Excellent. Thank you very, very much. The questions are coming in fast and furious now. There's been a comment here that said, should there be a dedicated resource team or hub to support research to develop research? To support researchers to develop relationships and create networks. Ashra, I think that speaks to one of the points that you raised in regards to having that support of people who have gone before and can offer that. There are some costing implications because time is money, but that is one comment that's come through. There are few queries in regards to challenges. What challenges have you faced that you think will benefit from further support to facilitate some of the excellent work? So if we can address that question, and then I have a question that's linked specifically to the elephant in the room that you raised, Ashra, but I'll move on to that. So what challenges have you faced that you think might benefit from further support to facilitate this kind of work?
I think the challenges are, it takes time to develop relationships, and you also need to have, in terms of within your organization, your line managers need to be supportive of you sort of trying to do this engagement work. And then the money sort of, it's not really a large amount of money. It's a small amount of money just to facilitate that engagement. And it also means, as researchers, we need to sort of engage with the community. And for example, somebody might say, I'm just looking at proteins in a lab. What's that got to do with engagement? But that research has relevance to the people. You're doing that research to benefit people, unless it's for yourself, but that's a different issue. But if it's to benefit people, you need to know the community that's going to benefit from your findings. And it might be something that's overlooked. But I think it's time and resources is what's needed here. And the challenges are, there's always ways to overcome challenges, but once you have those relationships, other people help you to overcome challenges as well.
Ahmed or Esther, do you want to come in, or are we going to go to the next question? Okay, this next question I think is linked to Ashra, what you said about, I'm calling it applied research, or a researcher who has a social justice agenda and has no problem with that. And for me, it'll be a researcher activist, where you use your activism to conduct research. But you did mention the fact that the support is needed both for the researcher as well as an understanding of the research that is being conducted. So it's a general question of how best to facilitate that support. Esther, like you said, on all systems, multi-systems level, and then Ashra, in regards to, it could be career development, it could just be the acknowledgement of a particular type of meaningful and important research. That was a statement and a question. So how could we transform the system to appreciate that on a systems level, Esther? And Ashra, what support would you want to see for yourself and others who are working in the particular way you're working?
So I think this is a very interesting question, Roiyah, and very fascinating comment as well. And I think it's a live issue for anyone trying to do EDI at that system level, because as we know, EDI is so close to identity issues, so close to social justice issues. So how do you ensure people understand that you've got to take a systems level approach? And I think, Roiyah, I really don't have an answer to that, because I'm navigating that on a daily basis. However, I think that it is important that people understand that for systems to change, you've got to take that systems level approach, that you've got to deconstruct some of the things that have existed within systems to ensure that people think inclusively, people behave inclusively, and people do research in an inclusive manner. So I guess for me, there is a place for the two things to coexist, but I think it's working diplomatically to say, okay, when do you take an activist approach to something, and when do you take a systems level approach to ensure that actually the systems that we need to change to ensure that we have a fairer and more inclusive society have been impacted and have been changed. If not, we wouldn't change anything. We can't change anything if we don't address the systems.
Thank you. Thank you, Esther. And I could echo that as well. I think in terms of as a researcher who is in sort of, if you're interested in equity, we need sort of funding streams that sort of address those equity issues. A lot of funding is around top level health issues, and very little around the intersection between health and social, where a lot of the health problems are due to inadequate social issues, social issues inadequately being addressed. So I think the funders need to sort of look at how that can be, how the equity can be embedded in their calls. Also, what I mentioned earlier about engagement. So a lot of the engagement I do with the communities that I am interested in, I do it in my own spare time. So I'm part of a BME association in East Port Talbot. I'm also supporting Mind with another project that's working on ethnic minorities and the mental health. But these are all outside my work time. And I think if we really want to encourage researchers to get involved, is actually allowing them time and support to actually go, attend meetings in local authorities, attend meetings within social care or third sector organisations, so that that relationship is then there, that can be tapped into quickly when a research idea or a research gap is identified. So these are two I can think of at the moment without being too controversial. I think we've lost Roiyah.
I think we've lost Roiyah.
Yeah. Hello.
Oh, yeah, we can hear you, Roiyah.
Oh dear. Yes, I'm having trouble, but I'm trying.
It's okay. We can hear you.
Okay. Thank you for telling me that. We can go on to the next question. Kate, I'm going to have to ask you to read the questions out because I don't have the chat to hand.
Yes, sure. One moment, please. Sorry. There are a number of questions that have come in. So we've had the last question that came in as, do you have any experience with the Include framework? And if yes, have you found it practical and useful?
I don't. Sorry.
Go on. Sorry,
Yeah.
Esther, please.
No, that's all right. I don't personally have experience, but there's evidence of the Include frame guidance working, and all of that can be found on the NIHR's website. I have provided the link to Kate, sorry. So you should have access to that.
Thank you. Yeah, we'll add it to the chat afterwards. Thank you, Esther. There is another question. How do you ensure that diversity isn't just a tick box exercise? I'm sorry, I have been on the tech side as well. Has that been answered?
No.
Sorry.
We've covered that question in part, but I know that there's another question linked specifically to peer researchers and
Okay.
the success, how best to foster that level of engagement throughout a particular study, specifically focusing on asylum seekers and refugees and some of the particular issues they may face. How do you encourage participation as a peer reviewer or peer researcher? I beg your pardon.
So with the peer researchers, what was key was that within the community, for example, Rebecca, the third sector support worker or development officer, she had contact with some of the peer researchers. And Mohammed, you met Rebecca at Swansea Council for Voluntary Sector. So and so that relationship was already there in the community. And so when we costed in Rebecca to our bid, she was able to bring that contact with her. And since she's moved on to another post, the peer researchers that we work with are now actually providing us with access to other people in the community. So I think what is really important is having those networks and making sure you maintain those networks. So I think that's how we've engaged peer researchers in our team, building up that trust, and also having that diverse team as well, I think made people feel supported. Mohammed, do you want to say anything about your role as a peer researcher, or what worked? So what helped you sort of?
Yeah, thankfully to all the team members. It was a great experience. They were all helpful, and I could get lots of advice from my first experience to participate in this type of research. And yeah, that was a great opportunity for me.
Yeah, because we also had a training event session as well. So we didn't just say to people, here, take the questionnaires, please, and go out into the community. We had a training event so that the peer researchers knew what their role was and how they were to collect data for us.
Okay. All right, then. Thank you very much for those for the questions. Are there any further questions, Kate? If not, I'm going to thank the speakers and close the session. Do we have any questions?
I think it would be best if we thank the speakers, and that would be best. Thank you, Roiyah.
Okay, well, I've left with the task of thanking the speakers and for the presentations that they've made today. I want to thank all those who attended this particular session and who posed questions. I am going back to what both or all speakers have mentioned in regards to this not being a moment, but rather a movement and a way forward, and the whole idea of looking at it from a systems approach, an organizational management approach, through to the role that researchers play in how they design and work with and indeed conduct their studies. So thank you very much. Thank you for the organizers for bringing forth this particular topic, which I think is important, and I hope that this is the beginning or the continuation of a series of conversations and engagements to really move forward the equality agenda, the equality and inclusion and diversity agenda. We are going to take a break now, and the break will last until 3 o'clock, and that'll be followed by the final plenary of the day. The title of which is Recovery and Learning, New Ideas in Healthcare Delivery, and it'll be chaired by Dr. Andrew Goodall, and then onto the awards. So thank you for attending, and I wish you a very good day, and take care.
Thank you. Thank you.
Bye. Thanks.